Hello and welcome to my channel, Heal with Mike, where I'm going to be documenting my journey through corrective surgery for Scheuermanns or Scheuermanns disease. If you've made it to this video and you're on my channel, you're here for one of three reasons. One, you might know me personally or for whatever reason are invested in my health journey and my hopeful, awesome recovery, and for that I thank you for your support. Two, you might have Scheuermanns disease yourself, and that is the main reason why I'm creating this video, this channel, whatever this turns into, is to help people who are preparing for surgery. The most helpful thing for me, my surgery is 1 week from today. I have tracked down a lot of people who have gone through the process, learned about their ups and downs, asked some tough, hard questions, and really learned their stories, as well as finding some other videos. That was my dog that just ran by. As well as finding some other videos from other patients that I don't know, but those have been very helpful as well. So I hope that my story can be helpful for you and help you prepare for your surgery and an awesome recovery as well. The third reason why you might be here is maybe you don't have Scheuermanns disease, but you have some other form of a chronic ailment. I have been in chronic pain for 11 years now, starting when I was 17. I'm now 28 years old. And I've gained a vast and deep knowledge about food and eating healthy. I am a certified health coach from the Institute of Integrative Nutrition. I have learned a ton about exercise and movement. I worked for a physical therapy practice for 2 years. And I do a lot of mindfulness practices. I've worked with some meditation coaches, and I really know about how important staying on top of your mental strength is when sometimes your physical strength just isn't there. Something that I always say is a strong mind beats a weak spine. So if you can train your mind to be strong, no matter how much pain you're in, you will still be able to find joy in life and be happy, and that's really all that's important. Now that we're here, video number 1 is going to be about what Scheuermanns disease is, explaining what the corrective surgery is, and really going through my personal spine history and spine symptoms so that, again, you guys who might be going through this surgery can learn from me and just have a baseline of where I started versus where you are. No two spines and two spine cases are the same. Certainly mine has a bunch of variables which you'll learn about, but hopefully this can still help you in some way, shape, or form. Scheuermanns or Scheuermanns disease is a rare spinal deformity of the bones. What happens is one side of the bones is about this high, not actually that big, that'd be huge, but say it's the back of the bone is this high and the front of the bone is only this high. So the top of the bone creates this wedging, almost like a doorstop, instead of being like a perfect square. So when you stack a few of those wedged bones on top of each other, it kind of creates this rounded Hunchback of Notre Dame kind of feeling or look or appearance, an inability to totally straighten out. That is not due to postural issues, but the way that the bones are aligned, and that is Scheuermanns disease. It is, for me, and for a lot of other people I know, very, very painful, unfortunately. It leads to a lot of disc degeneration, compression on the facet joints, overstretching and thickening of the ligaments, creates a lot of muscle spasms in the area. For me personally, it's created a lot of instability, so I feel like things are shifting and moving, which then affects my breathing and my chest. It's really just terrible, terrible pain. I experience it at this point on a daily basis, and that's why I've opted for the corrective surgery. I wouldn't wish these symptoms on my worst enemy. That's the disease. The corrective surgery that I'm going to have is going to be fusing from the 5th level of my ribs, T5, to the 1st level of my lumbar, about L1. They are going to put rods on both sides of my spine. They're going to go through the back. They're going to put rods on both sides, screws through every single vertebrae, and hooks in as many places as they could possibly fit, the surgeon said. He says he puts the screw in, tries to lift me off the table, and if he can physically lift me off the table, he says, great, that screw's in there good enough. So I said, that sounds pretty crazy, and I'm lucky I'm going to be knocked out for that, but I look forward to you taking care of me, and I am assured in the best hands of my doc. He's been fantastic. I'm working with Dr. Cunningham at the Hospital for Special Surgery, and he and his team have been phenomenal. I totally trust him. I've asked him 1,000,001 questions. So one thing that's definitely important is having a trustworthy connection and you feel with your doctor like I trust mine. I'm now going to kind of rewind the clock to when I was 17 years old. I know I mentioned before, I've been in chronic pain for 11 years. So I'm going to take you back to when I was 17 and give you kind of some history on my spine and my case. I was not diagnosed with the disease until January of 2020 this year when I was 27 years old. So I went 10 years of having pretty much daily pains without knowing that it was caused primarily from multiple consecutive wedge segments in my lower thoracic. When I was 17, I started having daily aches and pains, shoulder tightness, some neck spasms, upper thoracic tightness. I started seeing a physical therapist and a chiropractor. I remember getting imaged and the doctor told me, it looks like you used to have a fracture at T2, but it healed and I was never fractured at T2. I think that should have been the first sign that my body was simulating or showing that it had been through some sort of trauma, when that had not been the case and already started to degenerate as a 17-year-old. Fast forward to just, kind of dealing with it again through physical therapy, exercises, and chiro. Didn't really help, but again, I was like 17 or 18 years old. It wasn't too bad. It wasn't stopping me in my daily life at all. When I was 19 years old, I was a driver in a very bad motor vehicle accident where my injuries were a broken wrist, which I had pretty immediate surgery on, and I fractured my back in a spot, and I also had a broken heart from that experience as well. It was very traumatic, and since that accident, me and my doctors and my team all thought that those aches and pains that I was having before were just amplified by the accident, whether it be whiplash or trauma to my lower back causing difference in my mechanics. By the time I was 21, 22, I started getting these 3 fingers on my right hand and up through my elbow. I would feel it right here in my elbow and then up through my shoulder. I could literally track it like a pencil line. And I would have these sensations starting around 21. By the time I was 24, it was pretty constant. It was pretty much every day. It was like always there, like kind of cold or pins and needles in my hand, sometimes warm, very just odd, clearly nerve sensations. And at that point, my surgeon decided, I was using also at HSS, a different surgeon this time, he decided to do a disc replacement to C5, 6, and 6, 7. That was my first spinal surgery. I remember waking up in the hospital and literally, I think it was the first thing I said was just, holy shit, I can feel my hand again. It was amazing. It was a pretty seamless recovery. I do have 4 metal plates and 2 fake discs in my neck. I have so much mobility in my neck still. I haven't had hand symptoms a single day since then. The shoulder tightness went away. It was pretty miraculous. I recovered in about 4 months at the time. Again, I was young, I felt great. I would say by the 5th month, I was running a few miles every day. And then I started feeling my lower back start to hurt. And I went back to my doctor and I said, now my lower back's hurting. And we got it imaged, and actually the exact same spot that I had fractured in the car accident had just completely degenerated, was totally wedged. Like 30 to 40% of the height on one side was just missing. There was a massive Scheuermanns node that was going about 50% into the bone. I will try and put an image here. I don't really know how to do it, but I'll try and put that image right there so that you guys can see what that looked like. That was like a nasty looking thing. Again, it was also pressing on the spinal cord a little bit, so I had nerve sensations down my leg, especially when I went to the bathroom. I remember every time I would go to bear down, my leg would just pins and needles, just every day. And it would happen other times, you know, when I was working out, when I was riding a bike, any type of those signs of using my leg muscles, it would just give out on me, and really just almost like completely numb. It was pretty scary sensation. I ended up having just a 1-level fusion at L3-4. That was a difficult recovery. It took me about 6 months to feel any better. And then once I actually hit that 6-month mark, I remember just kind of like taking off. Again, probably 6 to 8 months after that, I started feeling some thoracic pains. And for me, I thought, okay, I had a cervical surgery, I had a lumbar surgery, my mechanics are being thrown off a little bit. I went back to the same team of doctors and I said, hey docs, something's not normal, something doesn't feel right in my thoracic. And they said, let's get it imaged. And sure enough, the doctor who did my cervical surgery said to me, every single disc is shot from cervical pretty much all the way down. That there was clearly something systemic, that it was probably Scheuermanns disease. And then I went to go schedule a consult with his colleague who does the thoracic, who is my current surgeon, Matthew Cunningham, who was able to confirm my diagnosis of Scheuermanns disease. So that was in January of 2020 this year. I know that was kind of a long-winded kind of explanation and rapid timeline from when I was 17 and having 2 spinal surgeries at 24 and 25, and then a few more years of pain. I've now dealt with these symptoms of the Scheuermanns, the thoracic tightness, slipping, instability, difficulty breathing, really just terrible thoracic symptoms for almost 2 years now. And when I met Dr. Cunningham and we confirmed the disease, I did the best that I could to manage it with my physical therapy and nutrition knowledge. Unfortunately, it has still left me feeling kind of worse and worse every day, and I have opted to do the corrective surgery. Most of the time, the corrective surgery is from like T2 to L2, something bit like a 12-level fusion. The reason why I'm going shorter is because of the location of my other surgeries. Because it's known that the levels above and below fusion sites are at risk or more vulnerable for further degeneration, or to be hypermobile, or develop some instability issues. Because I have a floating fusion down here and a disc replacement up here, if we went all the way to T2 and we went all the way to L2, those few segments, those 1 or 2 segments in between, would have been so vulnerable that we've decided to start at T5 and go to L1. Another reason why my case is able to do this, as you can see, is I am not too kyphotic. I actually have, you know, a fairly flat back. It's not very rounded where people even think that I have Scheuermanns disease. In fact, when I've met normal doctors who just know about the disease and are not experts to know that the wedge segments lower might not present a higher curve, this is called Scheuermanns disease type 2. They look at me and they're like, no, you don't have Scheuermanns disease. I've seen Scheuermanns disease people and they're totally hunched over, and it's so obvious when you see it. No, you certainly don't have it. And sadly, that's part of the misinformation in this community, and something that I hope my channel and my story maybe helps raise the awareness of, that like it doesn't have to be, the degree of the curve does not correlate to the degree of pain. It's actually more correlated to the location of the apex, and my apex and my wedging is in my lowest possible segments, and therefore my pain levels are likely higher than someone who might have all the wedging up here and look totally rounded. When I was diagnosed, I made sure of a few things. I made sure to find a specialist to diagnose me with my disease. Confirm the diagnosis with a secondary specialist. Third, know your numbers. I know some people who say, oh, I don't know the degree of my curve or my Cobb angle or my scoliosis Cobb angle or kyphotic Cobb angle, whichever one you're referring to. It is worth it to know your numbers. I know that I'm in the 50s for my kyphosis angle. I have about 18-degree scoliosis angle that goes left. I know where my apex is. Numbers are important. You should really know your information and not just rely on the doctors to be the experts. I view knowledge as power, and if you can know your numbers or know your symptoms or know your protocols as best you can, that will set you up for optimal success. The second thing, I'm at like 4 now. The fourth thing that I would do is get a bone density scan. Oftentimes, Scheuermanns disease is related to bone density issues. I'm 28 and already have osteoporosis of like a 70-year-old. If you're considering surgery, it's super important that you have a bone density scan, because if they're gonna put so much hardware in you, the density of your bones correlates to the ability of that hardware to stick. So I know that I certainly am at some increased risk having osteoporosis, and that's why my doctor said we're gonna put screws at every single level and as many hooks as I could possibly fit. Fifth, find a physical therapist. This is a rare disease. I know some people say physical therapy doesn't help me. To be honest, physical therapy doesn't help me either in like my day-to-day feeling, not really, but it definitely helps a few things. It helps my mental kind of sharpness, focus, to be able to just do some exercises, have some sort of home program. It's nice to be able to get access to like electric stim, some heat, even though I have those things at home, kind of better equipment out of the physical therapy place. Some manual physical therapy from the therapist is very helpful. Every physical therapist is gonna deal with like kyphosis stuff, but like if you have a physical therapist that knows your case and is willing to either study Scheuermanns disease or has had Scheuermanns patients in the past where they could bring in those experiences, that is hugely important. Things go chronically missed in Scheuermanns cases, like really tight hamstrings. So like I know when I go to my physical therapist, the first thing that we do is I'm on my back and we are stretching out my hamstrings, even though my problems are here. But because you're so hunched over, the pelvis kind of is constantly in that posterior pelvic tilt. The hamstrings are constantly in a shortened position and chronically tight. The next thing, and this is something that I really wish I had done sooner, is start working on your mental strength. When I was diagnosed, I thought I was tough, but like, admittedly, this thing has beat me down quite a few times. And I've had to build myself back up. You know, I would be remiss to say that it's been like anything but really, really difficult at times. I always say that you can't love yourself for only your positive reviews. Like, you can't love yourself for what you're great at and just say, oh, I just wish that wasn't part of me. If you love yourself, it's weird to say, but like, I love myself and I love having the disease. It's part of me. It's part of what's created my personality. It's part of what's shaped my life view. It's part of what shaped my priorities. Although it's broken me quite a few times, you have to also, to love yourself, you have to love your Scheuermanns disease. You have to love your chronic illness or whatever it is. So yeah, so those are the things. Specialist. Second specialist, learn your stuff, physical therapist, work on your mental strength. Those are the 5 things that I would do when diagnosed. I hope that this first video was a little bit informative, probably not too entertaining. The next video, okay, so moving forward, surgery is 1 week from today. I did film myself talking about some of my pre-op checkup stuff, so I'll post that. I'm gonna post a video about some of the things and equipment that I bought pre-surgery, or I might just wait and do that after surgery now that I'm thinking about it, about what's been working for me. I am gonna post a video about the foods that I've been eating and the exercise routine that I do pre-surgery, and a pre-surgery checklist. So hopefully that's to come soon. And yeah, I look forward to taking you guys on this journey with me. I hope it's super freaking successful. Thank you for being here. Thank you for your support. And I hope you can learn a lot and you can heal with Mike.